Thalassemias are inherited conditions where one makes less red blood cells than needed, and that's because there are issues producing the hemoglobin protein, the core of every red blood cell. Not all patients with thalassemia have anemia. However, many patients with thalassemias do have anemias, which is caused by an inability to produce normal hemoglobin or red blood cells. Symptoms related to anemia: shortness of breath, getting tired easily, being more fatigued. Some patients might experience hair loss and skin changes as well. Hemoglobin, which is the protein at the center of every red blood cell, is composed of two subunits, an alpha subunit and a beta subunit. In alpha thalassemia, patients have issues making alpha hemoglobin. In beta thalassemia, patients have issues making beta hemoglobin. Beta thalassemia is an inherited condition from either one's father and or mother. Some patients with thalassemia are what we term carriers. These carriers are patients who have thalassemia trait and don't typically have many of the symptoms. Knowing that one as a carrier for thalassemia is important, as one can pass it on to one's children, and there is a risk for developing a worse anemia. When one gets a blood count or a CBC, sometimes they can notice some abnormalities. This can be a mild anemia, or sometimes the red blood cells can be small or have a very wide variation in the red blood cells. If this occurs, testing for thalassemia involves special blood tests. One of those tests is called hemoglobin electrophoresis, though there are other more complex tests available as well. These can be performed by your primary care doctor or a hematologist.